Hello everyone, this is Dr. Issa, your OBGYN on call. If you're new to the channel, we cover everything that you need to know about sexual wellness to keep you informed and empowered. If you're interested in learning more about sex, sexual health, and pleasure, then make sure to subscribe to the channel and tap the notification bell below. For this video, I'll explain what oral sex is, clear up some common misconceptions, and share tips on how to avoid risks like sexually transmitted infections. Whether you're the giver or the receiver, these insights will be very helpful. Let's begin! Oral sex involves using the tongue, lips, or mouth to stimulate a partner's vulva, penis, or anus for sexual pleasure. People of all genders can give or receive oral sex, making it a widely shared experience that many can relate to. It comes in 3 types. First up is mouth to penis, commonly known as a blowjob, fellatio, or giving head. This is one of the most well-known types of oral sex where the mouth, lips, or the tongue is used to stimulate the different parts of the penis. Techniques can vary from licking, sucking, or deep throating. Deep throating is when the giver takes the entire penis into their mouth, reaching the back of their throat. Next is mouth to vulva, also known as cunnilingus, going down, or eating out. This involves using the mouth to simulate the different parts of the vulva, which is the external part of the female genitalia. This type of oral sex can be extremely pleasurable, especially for the receiver, particularly when there's special attention given to the clitoris. The clitoris, which is located at the top of the vulva, has over 10,000 nerve endings, making it highly sensitive and a central focus for pleasure. As for techniques, it can involve licking, sucking, or even gentle blowing to create an orgasmic sensation for the receiver. Some people might even incorporate using their nose or their chin for added stimulation. Finally, there's mouth to anus, usually referred to as analingus, rimming, or a rim job. This involves using the mouth to stimulate the anus. While some may feel hesitant or unsure about this, the anus is packed with highly sensitive nerve endings as well. Techniques like gentle licking, sucking, or soft kissing can create surprisingly intense sensations. Due to the long-standing taboos around sex, understanding and accepting it has been a gradual process. Despite the progress we've made in sex education, thanks to the many educators openly discussing sexual health, some misinformation persists, especially with oral sex. Let's clear up some common misconceptions and get the facts right. Everyone loves to give and receive oral sex. Oral sex can be a great experience for people of all genders, but not everyone is comfortable giving or receiving it. Preferences vary widely, so it's crucial to have an open and honest conversation with your partner about your likes, dislikes, and expectations. Misunderstandings can arise when one person expects oral sex while the other one is not interested, or if they feel anxious about their performance. By communicating openly, you are able to address any concerns and find a way to enjoy this aspect of intimacy together. You should only use your mouth when giving oral. Although oral is in the name, you are not limited to just using your mouth during oral sex. Get creative and involve other parts of your body like your nose, chin, or hands. You can also spice things up by incorporating sex toys into your oral play. Here are some great options to consider. Mini vibrators. These little bullet-shaped vibrators are compact and offer precise stimulation. Tip vibrators. While not as common, these vibrators focus all their power at the tip, delivering intense and concentrated pleasure. Open-ended strokers. This love toy is perfect for blowjobs. They have an open-ended design so you can use them to stroke your partner's shaft while keeping your mouth busy on the tip. Oral sex isn't real sex. Some people believe that oral sex is not real sex and it's just a prelude to other activities. Although it's often used as foreplay, oral sex is a legitimate form of sexual activity. Sex includes a wide range of activities beyond penetration, like fingering, genital rubbing, masturbation, and of course, oral sex. Not only that, but for many same-sex couples, oral sex is their primary way to give and receive pleasure, so it's important to acknowledge it as an integral part of sexual expression. You can't get sexually transmitted infections from oral sex. Another myth about oral sex is that it doesn't carry any risk in transmission of sexually transmitted infections, or STIs. STIs can be transmitted from the genital area to the mouth and vice versa because they thrive in warm, moist environments. They spread through body fluids or even direct contact with infected skin and open sores. So practicing safe sex is still important even when you're just giving or receiving oral. As we touched on earlier, oral sex can carry the risk of sexually transmitted infection or bacterial and viral infections. I'll go into more detail about these risks soon. But first, let's focus on the main topic of this episode. Let's explore some tips on safe oral sex. Number 1, always get consent first. Just like with any sexual activity, consent is absolutely essential. For those new to this term, consent means that everyone involved enthusiastically agrees to participate in the sexual act. This can be communicated through verbal cues like saying, "Yes, I'm interested," or "I'm okay with this." While nonverbal cues may also indicate consent, they may not always be as clear. Having a conversation before and during the deed is better than just waiting for these nonverbal cues. A simple question like, "Do you want me to do this?" or "Is it okay with me touching you there?" is enough. Now, going back to oral sex. If your partner is not interested or is not ready, then it's important to respect their decision. Pushing, pressuring, or making ultimatums is never acceptable. Consent should be freely given and enthusiastic. If someone is threatened, coerced, or manipulated into saying yes to an activity, then that is not true consent and constitutes sexual coercion. Number 2, be open with each other's sexual health history. Another important step is to discuss your sexual history and STI status with your new partner. If you are unsure of what to ask, then consider asking these questions. How many partners have you had recently? When was the last time that you had sex? When did you last get tested for sexually transmitted infections? Have you gotten an STI before? If you can, consider getting STI tests together. This will promote transparency and help ensure safety for you and your new partner. Number 3, use barrier methods for protection. Now, if you haven't had the conversation about your sexual health history, or this is a spur-of-the-moment situation, you can still protect yourself by using barrier methods. This involves placing a thin barrier between your mouth and your partner's genitals to prevent direct contact with their genital fluids. Here are 3 products that you can use. A dental dam is a thin square sheet that is made of latex or polyurethane that is placed over the vulva or the anal opening. It's great for cunnilingus and analingus, offering a reliable barrier against STIs. Remember that the dental dam only covers a small area, so fluids can still seep around the edges. To maximize its effectiveness, hold it in place during use. Another effective method is a male condom, one of the most versatile contraceptive methods available. This thin pouch is rolled over the penis to prevent semen and other genital discharge from coming into contact with your mouth. Male condoms come in various materials like latex, polyurethane, polyisoprene, and lambskin. It's also available in many styles like smooth, textured, flavored, or even glow-in-the-dark. For oral sex, flavored condoms are a great choice because they add a pleasant taste, making the experience more enjoyable to the giver. While male condoms are typically used for blowjobs, you can also repurpose them as makeshift dental dams. Here's how you can do it. First, prepare 1 condom and sanitized scissors. Unroll the condom and cut off the tip and the base. Cut the condom lengthwise to create a rectangular sheet. Place the latex square over the vulva or anus. And that's it, you now have your dental dam. Most condoms come pre-lubricated, but if yours isn't, you can apply a small amount of water-based lubricant to the side of the dental dam that is facing the vulva or the anus. So for a third barrier method, let's talk about the cling wrap. While it's not the ideal choice for oral sex, it can be a handy backup. You see, cling wrap isn't specifically designed for genital use, so it can easily tear or create holes if not handled carefully. However, if you find yourself in the middle of the moment and you don't have a condom or a dental dam, then cling wrap can serve as a temporary solution. So what you'll do is to grab your cling wrap and cut a small portion of it to place on your partner's vulva or anus. To increase sensitivity, apply water-based lubricant to the side of the cling wrap that is facing the vulva or the anus. With that in place, you can now proceed with the deed. Number 4. Avoid brushing your teeth before or after oral sex. Many people don't realize this, but it's important to avoid brushing before or after oral sex. It might seem like a good idea to freshen up your mouth, but brushing your teeth can cause micro tears to your gum, which can increase your risk of exposure to bacteria and viruses. Instead, you can use an antibacterial mouthwash if you need to clean your mouth before or after giving oral sex. Also, to be safe, if you've already brushed your teeth, then give it around 30 minutes after brushing before you engage in oral play. Number 5. Avoid oral sex if you have cuts or sores in your mouth. If you have mouth sores, cankerous sores, or any minor cuts in your mouth, then it's important to skip oral sex until after they've healed. These sores can serve as an entryway to bacteria and viruses, increasing the risk for transmitting infections. Number 6. Practice good oral hygiene. Here's a tip especially for those giving oral sex. Maintaining good oral hygiene is a must. Not only does it prevent mouth sores that can be uncomfortable and can hinder your ability to perform oral sex, but it also protects your partner from getting bacterial infections. To keep your mouth in top shape, follow these practices. Brush twice daily. Use fluoride toothpaste and gently brush your gums, teeth, and tongue. If you wear dentures, then clean them thoroughly and ensure that the skin under is fresh. Rinse regularly. You can use mouthwash to help kill the bacteria. Limit sugary food. Too much sugar can lead to bacterial buildup. Cut back or quit smoking. Smoking can affect your oral health and hygiene. Get regular dental checkups. Visit your dentist at least once a year for professional cleaning. 7. Limit the number of sexual partners. Ultimately, the choice of how many sexual partners that you can have is entirely up to you. Casual encounters and hookups can be enjoyable if that's what you're into, as long as you're practicing safe sex. However, it's important to remember that having more sexual partners can increase the risk of STIs. Even with protection like dental dams and condoms, there's still a chance of exposure if the condom breaks or if your partner is not honest about their sexual health history. By limiting your number of partners, you can reduce your risk for STIs and build trust with those you choose to be intimate with. And finally, get regular STI testing. Getting tested for STIs is a crucial step for anyone who is sexually active, whether you engage in oral sex or not. You might be wondering, why should I get tested? If I have an STI, then I can just get straight to treatment, right? While it's true that testing does not prevent transmission, it can identify which ones have the STIs or not. It plays a vital role in your sexual health. Many STIs are asymptomatic, meaning you might not show any symptoms until the infection has progressed to a more serious stage. Regular testing can help you to catch any infections early, allowing for early treatment and better management. It can also give you peace of mind if your results turn out negative. If cost is a concern, then there are organizations like Love Yourself that offer free HIV testing and affordable STI screening here in the Philippines. Now, let's talk about the risks associated with oral sex if safe practices aren't followed. Without the proper precautions, you and your partner are at risk for a range of conditions including chlamydia. Chlamydia is often called the silent infection because a lot of people who have it don't experience any symptoms. While it's rare for chlamydia to be transmitted through oral sex, since the bacteria prefers the genital area rather than the throat, there might still be a small risk. Gonorrhea. Like the previous infection, gonorrhea is also known as the clap. Like chlamydia, it can also be asymptomatic, while some people will experience an abnormal discharge. Like chlamydia as well, it is treatable. Though it's also uncommon for gonorrhea to be transmitted through oral sex, it's still possible. Herpes. Herpes is a sexually transmitted infection that causes itchy, painful blisters around the lips or in the genital area. The infection spreads through direct contact with sores and broken skin. Syphilis. Syphilis is an STI caused by the bacteria Treponema pallidum. If untreated, it can lead to severe long-term health issues like brain damage or blindness. You can contract syphilis through oral sex if you have direct contact with the source or lesions from an infected partner. Hepatitis A and B. Another risk of having unprotected oral sex is contracting hepatitis A or B. Hepatitis A is primarily transmitted through oral contact with feces, which can occur during rimming. Hepatitis B, on the other hand, can be transmitted through semen or vaginal fluids, so if your mouth is in contact with these secretions, then you can be at risk. Human immunodeficiency virus or HIV. HIV, or the human immunodeficiency virus, attacks your immune system by targeting CD4 cells that help protect your body from infections. You may contract HIV by giving oral sex to someone who is positive, especially if they are not undergoing any treatment. Remember though that HIV-positive individuals undergoing treatment that have an undetectable viral load cannot transmit the virus. Undetectable is equal to untransmittable. Intestinal parasites such as helminths and protozoa. Many people contract intestinal parasites by unknowingly ingesting eggs passed through feces. Mpox. Mpox, previously called monkeypox, typically causes flu-like symptoms like fever and chills and is associated with a rash that can take weeks to go away. Researchers are still investigating whether this virus can be transmitted through the semen or vaginal fluids, but it seems that it's possible that skin-to-skin contact alone can already transmit the virus. Throat cancer and human papillomavirus. If you've been online lately, you may have come across some posts that claim that oral sex is a leading risk factor for throat cancer. This is because of the human papillomavirus, which can also be transmitted through oral sex. HPV can lead to precancerous changes in cells, which can result in throat cancer over time. This list only scratches the surface when it comes to sexually transmitted infections. Each of these topics deserve its own deep dive, so don't worry, I'll be exploring them in much more detail in future episodes. And that concludes our guide to safe oral sex tips. If you've made it this far, I sincerely thank you for watching. Your support means a lot, and by liking this video, you're helping us break down the stigma surrounding sexual health and wellness. We've got plenty more episodes lined up in this series, so remember to subscribe to the channel and hit the notification bell to stay updated. See you in the next video. Bye!